Hello, my name is Dr. Greg Symko. Another pattern or another problem with the thyroid gland is something, well, there is an enzyme in the thyroid gland called thyroid peroxidase, which is TPO for short. It actually is an enzyme that release helps release iodine to make the hormones that the thyroid gland produces so that your body can function normally. So thyroid peroxidase is an enzyme, again, that helps cleave or release iodine for the thyroid gland to utilize. Now, what can happen here is that your body can have antibodies. Your immune system can be sort of out of whack a little bit and can have antibodies to your thyroid peroxidase, TPO. Now, this is a test that can definitely be checked, and you can find that out. Now, effectively what happens is that it starts killing or destroying these enzymes, so your thyroid gland won't be able to produce the thyroid hormones because iodine is not being released. So taking iodine supplements is not going to help because you don't have the enzyme that's able to produce or cleave the iodine in order for your thyroid gland to produce the thyroid hormone. So it's very important to find out if you have thyroid symptoms. It could be hyperthyroid or hypothyroid. Initially, when your immune system starts attacking this TPO, you get hypothyroid symptoms. Later on, they become hyperthyroid symptoms. And this is usually associated, a classic thyroid disease called Hashimoto's disease. Not everyone that has everyone that has Hashimoto's disease has an antibody to TPO. And it matters of degree of this antibody. Initially, when antibodies start developing, your symptoms are not that severe until they really start kicking in and start killing off your enzymes, the TPO enzymes. So it's very important to determine if your thyroid condition is caused by this problem, thyroid imbalance due to TPO enzyme destruction by your own body. There are ways of dealing with that. There are ways of finding it out, and there's ways of dealing with that. But you're not going to be able to deal with it if you don't know for sure. So you need to find someone that would look into if you do have antibodies to your TPO. So you see that the thyroid axis, or thyroid symptom, is very complicated. It's more than just looking at TSH or T4. T4 being produced by the thyroid gland, TSH being produced by the pituitary gland. It's more than that. It has to be. Otherwise, you're not going to fully understand what is going on with you. And if you don't understand what's going on with the system and what's causing your problems, you're not going to be able to fix them. So you need to find someone that understands and will look at these things so that you can get your help that you need.